Foundation. My name is Uday Sakaraya from CMC, and permit me to introduce the people on the dais. So, starting from my right and your left is Dr. J.V. Peter, former Director, Christian Medical College Fellow. Dr. Vikram Matthews, Director of the Christian Medical College Fellow. Anurag Behra, who is the CEO of the Yazim Premji Foundation, and Dr. Kenny David. Presentation from the CMC side by Dr. Kenny David, followed by a small presentation / remarks by Anurag Behra, and after which over the next 30 minutes we will have question and answers. I request you at that point to please identify yourself by name, the publication you represent, and whom you are addressing the question to. So with that, can I request Kenny to...
Friends, and I want to extend a warm welcome to each of you, especially the members of the press and media who are here this afternoon to mark this event, which is a landmark event, I believe, in the history and evolution of CMC Vellore. An MOU which commemorates the signing agreement between the Yazim Premji Foundation and Christian Medical College Vellore for the establishment of a medical college, a teaching hospital, and all the supporting services that accompany such an endeavor at the Chittoor campus, which is the neighboring district of across the border from Tamil Nadu, from Vellore district. My name is Kenny David. I work as an orthopedic surgeon at CMC, but for the last 4 years I have been privileged to look after this campus, the Chittoor campus, and I hope in the next few minutes to provide you an overview of the work we do at CMC Vellore and the work that we have initiated for the last decade or so in the Chittoor campus. And I hope that will set the stage for all that is going to happen in the weeks and months and years to follow, which follows the signing of this agreement. I'm sure the CMC Vellore is not an unknown name to any of you. However, we've got a lot of information that is put together in these handouts that have been provided to you. Let me just give you a brief overview of where we are, where we started from, where we stand, and what we see as the future directions as we go ahead. CMC Vellore was established in the year 1900 as a single-bedded dispensary by an American doctor called Ida Scudder, whose parents actually worked in India, and before she ever did what she did, and the fruits of which we see today. Actually, the entire family has sent 42 members to India to work in different areas, many of them in medical work. And someone has calculated that if you actually total the number of years that single family has invested in India, it comes to over 1,100 years. So that is the legacy with which we, on which we can look back. And Ida Scudder started in 1900. We are now in the 125th year of our existence. In the year 2025, we'll be celebrating 125 years. We are now spread across 7 campuses, 3 districts, and 2 states. The youngest campus, if I may say so, well, not the youngest, but almost the youngest, is the Chittoor campus, which we started in the year 2011, but the seats were sown a few years before that. CMC Vellore stands on 3 pillars: education, service, and research. And I'd like to briefly touch upon each of these 3 because each of them has an important component of our identity. I'll start with education. We have around 2,000 students from different courses who are being taught at any given time in CMC. There are more than 220 courses that we run, and of course the flagship is probably the MBBS, and most people hear about the MBBS and the postgraduate and the higher specialty degrees, but there are a host of other courses that CMC runs and which supply manpower to different parts of this country.
Remotest corners of this country, the most difficult places in this country, where nobody wants to go and work for anything. Forget about being a doctor who can earn a few million in Bangalore or even in Hubli. Nobody wants to go to these places. But if you go to these places, and I just listed 4, I'm sure you could list 200 places more, right? Yeah. So we could list n number of places where nobody wants to go, but if you go there, you will find a good hospital. You'll have dedicated nurses also, dedicated doctors, other para-health professionals, and incredible as it might sound, but 80%, 90% of them come from CMC. What does it tell us? What it tells us, what it told us as in the Azim Premji Foundation, when during COVID we went around the country trying to figure out how we could help, right? So we went to all these hospitals. What it told us, there's something truly special about this institution. See, all of us know that if we are really ill, we have some really complicated problem, Vellore is nearby, we can always go there. CMC is known as an exemplary institution for complex medical issues. We all go there, we know that. But AIIMS is also like that. So you have at least 4, 5, 6 institutions in the country which can be counted in the same, on the fingertips. But then what's so special about CMC, because of its graduates, are the only people, or mostly the people that you find in such places. And that's what really hit us, hit the foundation, hit my colleagues, many of them are here, when we went to all these places. And we realized, and then we had the privilege of meeting this team, and of course then working closely together with them, that this institution over the past 124 years has built an ethos and a culture which truly prepares healthcare professionals not just to be the most competent in the country, which it is, but also the most service-oriented. Truly, all our dreams of Dr. Kotnis ki Amar Kahani and all that, I don't know, most of you seem to be too young to remember Dr. Kotnis' Amar Kahani, but all this vision we have of service and doctor, they have truly built an ethos and a culture. And it's not just for the sake of saying it, they have done it over the past 125 years. So, you have expertise, competence of the highest order, and you have dedication and commitment to service to this country, the people of this country, the most vulnerable of the highest order. So, therefore, our assessment, this is a truly special institution. Unfortunately for this country, there are not so many of these institutions. CMC has been such an important supporter and collaborator of ours as we have tried to work in health. And of course, it's a privilege to be able to support this new medical college and hospital that CMC is starting in Chittoor. So, with my best wishes to CMC and with gratitude for all that you've done, and I'm sure you will do. Thank you so much.
The opening a hospital in Chittoor is one, we have the resources there. We have land there, we have the ability, and we have the support of the government from there to open a hospital. We already have a hospital, we want to expand the hospital and then eventually work towards a medical college. But the objective is to set up a medical college, and our medical colleges are conventionally different in the way we administer them in terms of the fee structure, training, etc. But in this particular medical college, we want to focus our training on secondary hospital care. So that's a little different, and the objective is to set up a model system that can be replicated across the country in terms of training and sending out people. What this country does not lack is high-end tertiary quaternary care centers in most metros are as good as anywhere in the world in many places, in many times. But what we really lack is good primary and secondary care hospitals where people don't have to come to the metros, and most of their diseases, 95% of illnesses, can be taken care of in the peripheries at low cost, effective care without having to come to tertiary and quaternary centers. We were very happy to work with Azim Premji Foundation because we really believe we have a shared vision and mission. They're also going out into the healthcare outreach programs in secondary hospitals and primary hospitals through the country. That's one of their goals and objectives. And we thought this would be a great opportunity for us to partner with them. It's not just about them helping us fund this hospital at this point in time, but we believe this is a long journey and it's a partnership in expanding and improving healthcare, especially secondary healthcare across the country. Bangalore and Chennai are not places that really need a secondary hospital at this point in time. That is the urban poor that need to be addressed. That's a separate question, and that has to be looked at separately. But at this point in time, we don't have a direct plan in Chennai. The timelines. So this project has actually been working on these timelines for quite some time, and with this grant being available, with the clearances, there's this, we hope to get the clearances all through in the next 6 months, and in the next 2.5 years after that, so about 2.5 to 3 years from now, the hospital will be running. For the medical college to happen, this hospital will have to be running for a minimum of 2 years with 60% occupancy before we can go to NMC and get the approvals for a medical college to start using the same resources. And further expansion will go in a phased manner over the next 10 years. But the hospital itself will be up and running in the next 2.5 to 3 years. That's the 422-bed hospital, 412-bed hospital. The second part, do we have plans to start multiple hospitals like this? You are absolutely right. We don't have the resources. They are constrained by the resources available to us at this point in time. This itself is a major exercise. And our focus is not so much on setting up hospitals as so much as training personnel to go out and work in already established centers, including district hospitals, etc. There are many resources out there. The biggest constraints in healthcare is personnel and personnel in the appropriate locations. 280. So 280 is the minimum we need. So we are upgrading this hospital to a secondary hospital. It's functional right now at 140 beds. We're scaling it to a 400+ bed hospital, and that hospital has to be running for a certain period of time before we can start the medical college.
Okay, and once you get the 400 bed, you have a 100-seat capability that comes in for medical college.
The choice is ours, but we would start with a request for 100 seats for medical college if everything goes along our plans.
And when you say you want to create capabilities for secondary healthcare, you're looking at skilling people there, and of course those people will go around in other parts of the country and set up establishments.
That's right.
Alright. Just last question. How exactly is this grant being used? Is it for infrastructure? What goes into it?
Right now the grant is essentially for capex of infrastructure. Let's help us establish the infrastructure.
Any research plans in collaboration?
Not in this grant. There's no direct research plans in this. This is essentially to establish the infrastructure required for the hospital. The cost is a little bit more than 500 crores, and this is the phase 1 component of the hospital. There are additional components that will come up later. As Kenny kind of put it out, and it's probably there in your write-up, we will finally go to almost 1,200 bed hospital in the second phase and in the third phase. After the medical college starts, we will further expand. So this is the first phase of the project, which I think is around 650 crores, and of which 500 crores is coming from the Azim Premji Foundation. But what we will be focusing is on secondary care, not that we will not have any specialties. Now CMC, if you come, it's actually a big enterprise. We cover everything from primary, secondary, tertiary and quaternary care. We have 2 major campuses in Vellore. One is the main campus, which is essentially a tertiary care center, and the one which is 10 kilometers away is a quaternary care center, which has really the state-of-the-art cardiology, cardiothoracic, hematology, transplants, etc. Here, the focus will be more on secondary care and some amount of tertiary care as required. But the focus is to enhance the education and training in secondary hospital.
My second question is, would you be connecting to the nearest places or other districts in and around Andhra Pradesh through this Chittoor hospital, through telemedicine or anything like that?
So that's definitely something that we should work at. So let me tell you how CMC itself works at this point in time. We work with multiple governments. We recently signed an MOU with Bihar. We have training programs with Chhattisgarh. We have training programs with Jharkhand. We have service agreements with Arunachalam, Nagaland. And these engage both on service, that they actually send patients to us. And we also, our biggest strength is education and training. So we are involved in upskilling and training many community health officers across the country. We have multiple nurse upskill training modules that we run for state governments who work with us. In fact, Dr. Jakin is there. If you want to meet her, she runs a distance medical education program. We have programs running in Africa where people reach out to us for upskilling. So we have a lot of capacity in the area of telemedical education, but telemedicine itself, I use that word very cautiously. There's a lot of medical legal issues in how you deal with it, and there's a certain infrastructure and requirement that is needed for that. But what the government of Andhra, what we would like to do, it takes two people to do this. With the government of Andhra, we would really like to work with each of their district units to upskill and enhance cost-effective medical care and enhance delivery and training education systems.
So have you begun talks in this regard with the government already?
Yes, we have. In fact, there were two people here in the room. They had to leave. One was Mr. Dr. P.V. Ramesh. He is actually the ex-chief secretary of Andhra Pradesh. He's now retired, but he's very close to the present government. And we've had discussions with him. We've not had discussions with the government. The government is just taking over right now. But through him, we hope to interact with the government and take this
Has got very close links with the communities around. And one of the hallmarks of our way of functioning is we realize we cannot simply run parallel systems, however good they are. We have to be able to plug into the government system and enhance their reach, their efficacy. Otherwise, we will be creating a parallel system which has only limited reach. So that ongoing relationship with the government has started even now in terms of community